We're going to be talking now about a dynamic digital splint system. This is a CMS strap. This is from the Bioskin Corporation. Advantages of this dynamic strap is thin. It's able to be fitted inside of shoes. It's washable with a wet cloth, and it's easy to apply. If this is simply too long, it can be trimmed and shortened for patient comfort. Primarily what that does is just simply reduces the bulk. The CMC, or the circumferential metatarsal strap, goes on right at the level of the metatarsals, and it is stretched and put on snug. And the reason for that, it can't be too tight, but snug. If it's on too loose, it actually will slide up and down, negating its effect and or producing some discomforts. We have here a small little osteotomy strap, and the function of this, once you undo the Velcro, the function of this is to go around the digits the tag will go up against the foot. You circumferentially place it around the base of the digit and pressing down at the level of the MPJ so that the digit is in line with the other digits. You simply Velcro this onto the bottom. The idea is not to take the digit and to pull it down below the level of the other digits. It's to be at the same level of the other digits so that if there's any attempt of dorsiflexion or bending the digits, there is resistance. This provides good stabilization. And this is what is known as a dynamic digital splint system. It's primarily utilized to stabilize the digit and avoid any dorsiflexion at the level of the MPJ, thereby preventing pulling or stretching of the volar plate. One of the modifications to the dynamic digital splint system is the utilization of exercise strap. It goes on similar to the osteotomy strap, and because it is elastic, once you apply it in the same fashion as the osteotomy strap, you're not pulling the digit down, you're maintaining it rectus on a horizontal plane with the other digits, but now you're able to exercise and you're able to provide resistance or dorsiflexion or plantar flexion against resistance, which will guard and prevent overextension or overflexion, thereby causing pain and or further injury. One can simply place it on the bottom. You can reverse it and place it on the top. And now you can plantar displace the digit in plantar flexion with this elastic strap on the top, providing some resistance and preventing too much plantar flexion and further injury or irritation. The final edition of the dynamic digital splint system is the Halix control strap, which has one elastic band. One of three is an elastic band, which can provide stabilization and or enhanced physical therapy. If we were going to utilize this for stabilization, we would put it on slightly medially, crossing on the medial aspect. The elastic band would course medially while you're maintaining rectus position of the first MPJ. You anchor the elastic band with that small strap so that when the patient is in bed or they're relaxing or recumbent, any pressure against the hallux will prevent it from going into abduction. If we were going to utilize it to enhance physical therapy, we would simply apply this in such a fashion that if it's placed on the bottom of the hallux, you would simply cross it over on the dorsal surface, utilizing the elastic band on the dorsal surface, again anchoring it with the small band, and now the patient can undergo active plantar flexion against resistance to enhance that motion postoperatively. We can also turn it around so that The elastic strap is on the plantar surface. Again, anchored with the small band, and the patient can now perform active motion in a dorsiflexion position against resistance, enhancing the physical therapy with that maneuver. Hello again. We've spoken about dynamic strapping for the foot, which encompasses the CMC strapping along with the hallux strap, the osteotomy strap, and the exerciser. Now we'll go through the billing for each of those items. Again, we will identify the visit by utilizing an E&M code. We will come to our CPT to identify the various items that we've used. We come down to our supply tab, click on supply, and all dynamic bracing starts with a calibrated compression wrap. So that gets clicked first. Depending upon what else is used, we have the hallux strapping, we have the while exerciser, or we have the while osteotomy. Obviously, you don't click all of these, you only click which one is being used. Okay, and as you can see, the CMC strapping and one of the 3 dynamic splint braces that have been applied. So you will come up, you will click 25, which tells the insurance company that there is procedures and billables to follow. You will use the CMC, again, laterality, right, and any of the other 3 braces you identify as right. In this case, we'll just use the hallux control strap. If this is a post-operative patient, we use a 58 modifier, and this tells the insurance company that this is related to the procedure, and we have to link the 58 modifier postoperatively with a instability code, and we can see the instability diagnosis listed right up in here. If it's not a postoperative, we don't have to use the 58 modifier, we use a 59 modifier. And we link that up with our diagnosis. In this case, it would be a sprain. So we have the E&M visit, the calibrated application, the hallux control strap application linked up with the modifiers, but one more thing has to be done. We have to, since there is time spent by the assistant in description and how to apply, we have to come to our strapping codes and we have to apply, again, our ankle foot strapping code, link it up with laterality, link it up with the diagnosis, and why don't we just, for sake of purpose, we're just going to remove this for now. So now we have our CMC hallux control, which can be one of 3 items, and then we have our strapping code, and this constitutes the totality of the coding for application of dynamic bracing. Hello, today we're going to be talking about the Strong Grim ankle brace. It provides stabilization to unstable ankles primarily by stabilizing the anterior talofibular ligament. It comes in a box that looks just like this, and inside the box are 2 items. One is the brace itself, and one is an instruction sheet that is for patients to refer to. The brace comes out of the package, and there's 2 components to the brace. There is a sleeve that slides over the ankle and leg, and 2 straps. The sleeve is intended to provide gentle compression, but really does not provide stabilization. The straps are what provides the stabilization. The sleeve is fitted, again, to provide, to just be snug, and slides over a sock. The large opening goes up over the leg, the smaller opening is behind the level of the toes, and the smallest opening is for the heel. We now have 2 straps, and if the injury is on the lateral side, we take the lateral strap first and cross it in front of the ankle, keeping it right in front of the ankle joint, passing it behind the ankle, and Velcroing it down. The second strap will simply go slightly higher and crossing from in front to behind of the ankle, and again we Velcro it down. For patient's comfort, you can always flip the top section down if it's too tight on the leg area. And now you have provided stabilization for an unstable or injured anterior talofibular ligament. If the injury is on the medial side of the ankle, you would simply take the medial strap, applying that first, and then use the secondary lateral strap on top of it. We've already spoken about the use of the Strongram brace for ankle instability. Now we're going to talk real quickly about the proper billing protocol that the clinical assistants can apply and enter onto the computer on the behalf of the doctors. So we come to the final screen on ECW entitled Billing, and under E&M, of course, we will put our code down, click OK, and now we go to CPT and we have to look for our supply. And we come down to the tab labeled Supplies, look for our Strongram brace code. Now this is the product itself. We also asked our clinical assistants to describe how to place the brace on the patients and their use and care of the brace. So that also is a billable charge. And if we come to the top, under Cast, Strapping, and Supplies, we can see right here strapping ankle and foot. That is also clicked. Okay, and now you have all charges listed. It's important now to identify whether it is right or left. We have to place a 25 modifier for the E&M code, and once we have identified right and left, because it's a supplemental procedure, we also have to utilize the 59 modifier, and you use the 59 modifier on the second one. The first one does not need it. If you move over to the right, you have to link it with a diagnosis, and now you have all the coding absolutely completed. Your E&M code with the modifier, letting the insurance company know that you have further items to follow, linked with a diagnosis, your individual items, the laterality, left or right, the subsequent item, which is identified by the 59 modifier, linked to your diagnosis codes. And that's the billing for a evaluation, treatment, and application of a Strongram brace.